Midwives, myth versus fact. I'm Marissa with NJMOM, and we're in downtown Jersey City at RWJBarnabas Health, Women's Health at Grove Street, breaking down some common misconceptions about what midwifery means for us mamas. All right, so first let's go backwards and take me back to before you were pregnant, before you found out you were expecting, what you thought a midwife was.
I actually thought a midwife was the person that actually delivered your children, and I assumed that an OBGYN was the person that you just saw on a routine basis. I didn't know there was a difference, or they could both do deliveries at one point.
What have you learned since you found out you were expecting?
Midwives do everything. They go from routine checkups to deliveries to postpartum care.
So how are you feeling today?
I'm pretty good.
Good. Baby's moving around.
Hi, my name is Annie Lawson. I'm a certified nurse midwife and the director of midwifery at Jersey City Medical Center. Midwifery in general started hundreds of years ago. In the United States, there's a few different types of midwives. There's lay midwives, there's professional midwives, and then there's nurse midwives. So all the midwives at Jersey City Medical Center are nurse midwives.
All right, Annie, quick rapid fire. Midwives, myths versus facts. So number one, midwives only do home births.
That is a myth. Midwives attend both home birth, birth center, and hospital-based birth. The largest group of midwives in the United States are nurse midwives, and they predominantly attend births within the hospital setting.
Number two, midwives and doulas are the same.
Myth. So midwives and doulas work collaboratively with patients, but doulas are more of the support person in the room, where midwives are the medical professional in the room.
Number three, delivering with a midwife means you cannot have an epidural.
Myth. Midwives are open to however a patient wants to deliver, whether that's unmedicated or with an epidural. We're supportive of both types. A lot of midwives have used epidurals themselves, so we are fully supportive of that choice as well.
Number four, midwives have no formal medical education.
Myth. There are three different types of midwives in the United States. There's lay midwives, professional midwives, and nurse midwives, and all nurse midwives are required to have a master's degree or higher to practice in the U.S.
Number five, there are male midwives.
True, there are male midwives, and they're still called midwives. Because we are all nurses, we have that philosophy of care ingrained in us, that patients are the center of the care. And I feel sometimes with physicians, it's a little bit more difficult because their patient volume is much higher than the midwifery patient volume, so we actually do get more time with our patients than doctors do. So that allows us to have a more one-on-one open relationship with our patients, and that's what most patients are coming to us looking for, is that little extra TLC that we provide.
And it's the kind of experience that I've always wanted, where the midwives care and the OBGYN care and support my choice in wanting a midwife.
Pregnancy is such a vulnerable time, and patients just in general feel more satisfied with their birth experience when they've been cared for throughout their pregnancy and their birth by a midwife.